Now, having said all this, um, how can we fill this gap? How can the gap be filled, knowing that there is a positive and a negative side to this migration, and especially how impactful is it on the economy and the manpower?
Some of the things that our governments do are knee-jerk reactions, for example. Quite recently, in trying to mitigate this dwindling number of healthcare workers, especially doctors, what the government announced is the increase or doubling of the carrying capacities of universities that train doctors or the medical schools. Medical education is highly regulated. A lot of schools can only have, admit 50, 60, I think some maximum 100 or 200 medical students, while in other disciplines, they may admit as much as 2,000 and all of that. Because the training facility is calculated by number, the number of students this can train. Now, what government has done is to increase the carrying capacity. No, it's not even the carrying capacity. It's to increase the number, the quota that each university can admit. But they have not increased the carrying capacity because this would mean that they have to improve on the facilities that are available to teach the medical students. Two, they have to improve on the number of lecturers, okay, and whether clinical duty lecturers, basic science lecturers who are going to teach these medical students. I have not heard that government has also approved that the number of lecturers for each of the medical schools should be increased. I have not also heard that the government has also made provision to expand the facilities that are teaching these medical. So that's one of the ways that government actually, do knee-jerk reactions to this. But if you ask me, it is a step in the right direction to say, let us treat many more people to become doctors. If we've been training 3,000 per year before, let's start training 10,000, 15,000. But there should be a commensurate increase in the number of lecturers. And you see, to retain these lecturers would also mean that you have to give them competitive remuneration for them to be able to stay, because a lot of our lecturers are also leaving. Then you must also be able to build the facilities that will accommodate this number of students that you are taking care of. That is one. Secondly, I usually tell people that if your children are going to the next house to play and you don't want them to go there, then go and find out what they are going there to play with. Provide the same. If you don't want your workforce to be leaving, look at what the remuneration is on the other side. You must be ready to offer something close to that, or the same or above. So that way they will not go, because whatever they're going to look for there, they will stay. And I also said that one other issue is the issue of the tools to work with, the working environment. They improve this working environment, and those who leave because of such would not leave. Provide the tools, provide the equipment to work with. Stop mounting what's it called, free health and free all these things. They are not working. They're actually causing problems for the system. Then also, in terms of the security of lives of doctors, we need to take care of that, particularly in the rural areas. So government is driving a narrative that makes people to get angry, to say that while I am suffering here, somebody is living, frivolously, living large at my expense, at the expense of what I can use to work for my patient. And so if we get a way out of that, rather than spend those monies on buying cars and all of that, you bring it into the health system or even education sector, you find people coming back to work. Because for the doctor, one of the first things is when you sit down, you recall that, oh, if somebody came in as a bad case and you had everything to be able to save that life, and you did, for example, the patient then even opens his eye and say, doctor, thank you. Your day is made. Okay, so these are things that would make the situation to turn around. We cannot continue to live on the lie that Nigeria, for example, does not have money. Yet, you find our political office holders living lavishly and all of that. So, this is one of the things that drive the anger of the average doctor, and they leave. So, we need to reverse that kind of mentality, and that will make people to say, okay, after all, we are tightening our belts. The politicians are also tightening their belts. And for that reason, you can say, okay, let patriotism come on the front burner. That is that area. Another area is that government need to push further on health insurance. Insurance in itself is a game of large numbers. As well, it is also that one single individual may not be able to afford 3, 4, 7, 10 million for a procedure. But if he had been putting 5,000, 10,000 into the pool, and all the total amount he has already is about 100,000, he can get a surgery that is going to cost 10 million done. And that is paid for by others in the pool, just like his own money would later pay for other people in the pool. But our people are insurance averse naturally. And when we talk to people to, take up insurance or health insurance, yeah, when I'm not sick, they wait till when they are sick to source the money. So the people need to change their mentality. Government itself needs to be more serious about, health insurance to be able to drive the healthcare system. Insurance brings a lot of money into the system that will be able to then do so many things that cannot be done. So whatever government needs to do in terms of orientation and all of that, will be able to help people to drive, the health insurance system. It would be good. But unfortunately, here is another challenge. Corruption is a major issue. Okay. Now, you will recall that the National Health Insurance Scheme was, grappled with some corruption allegations a few years back that caused the removal of the head of that scheme. Now it has been changed to a National Health Insurance Agency with certain modifications in what it can and what it cannot do. But that is still not working the magic. So health insurance has to be worked on. Possibly, government needs to now put more money than it is putting into, the capital expenditure or capex of some of these health institutions and put them on insurance. It's important that every Nigerian understand what insurance is and be able to put money in the pool so that, all that money, when they are available, will be able to help. Now, there's a big challenge again with health insurance in Nigeria because the number of people that are enrolled into the insurance scheme, perhaps maybe about 5% or so of the population, there isn't enough money in the system. And so what the health insurance companies are able to pay out to hospitals as capitation is very meager, between 550 naira and 750 naira per capita, and that drives nothing. So recently, there was a meeting between healthcare providers and the government, I think about 2 weeks ago in Abuja, where they were pushing for increase in the capitation and fee for service for health insurance. Most hospitals will not touch health insurance patients because it is like changing themselves when they can actually make their money from people who pay out of pocket. So health insurance is a veritable tool to drive healthcare in this country and provide, appropriate funds for the healthcare system.
So as we round up, I was going to also ask how the health professionals can also help in mitigating. Of course, everyone wants greener pasture. Everyone wants something better for themselves. But like, and you made mention of patriotism. But as an African, what are the things that professionals should do to ensure that, okay, um, to mitigate this migration process? Because as it is, by the time you get to the other side of the world, you see how it is over there. Just the same way you talked about your friend who has a lot of debt to pay. So it's not always like that the way it's, because you still have to go further. You have to do a couple of things to be able to still stand out beyond the amount of money that you will get paid for. So with this, I would also want you to advise health workers on what to do to ensure that, okay, we have a limited number of people living because people depend on them.
See that you yourself are laughing, at that request for me to talk. You know, the honest truth is that even for those of people who travel abroad, of course, they know that they have to do exams, they have to study for exams and all of that. But the question is the sacrifice worth it? Yes, in the long run, it is worth it. Because here, there are people who even go through residency and all of that, become consultants and all that. When you get up there, you still have to go back and do everything, after all the rigors that you're putting here. So in the long run, it's about how worthy is all the extra efforts that you have to put in. How soon would you recall? Now, I was taking up somebody who one day was talking to me just like you did to advise people not to leave. I am still here. When people ask me, they say, "You have not," I say, "I'm still here for now." Because I don't know what will happen tomorrow. Maybe I get frustrated by the system enough. Maybe my resilience is still, intact. I get to my own limits, my elastic limits, and then I have to leave. Many people who left yesterday, for example, were not thinking of leaving 2 years ago. If you ask them, they say, "No, I'm not going anywhere." And then you have to change their mind along the line. So when you want to tell people to stay, what are the selling points? What hope are you giving them that, okay, I haven't stayed in this, profession for the last 20 years, and you only have about 10, 15 years of active, service. That is when you can actually really work. And it looks back over the last 20 years and say, I have achieved nothing for myself. Yes, we've been able to save quite a number of people. Can I say I've saved myself? You would rather want to invest the remaining active years somewhere it can actually do some catch up. Okay. So it is difficult to really convince anybody to stay back because the truth of it is that for a lot of people, it's because they have not reached their elastic limits. So patriotism in itself is um, mm, is a relative thing, honestly. For some people who would have left, the only thing keeping them back is maybe they have aged parents that they know that nobody will take care of for them, some family ties and all of that, issues that they need to take care of before they set up. So these are issues that we need to look at. You cannot continue to beat a child and still be begging the child not to cry. That is what we're looking at. The system is beating the healthcare practitioners, and then you want me to tell them to stop crying. It's likely not going to happen. But I think we should still count ourselves lucky that we are where we are. We still have a few of us. But let me tell you one of the problems that is nature abhors vacuum. There are so many areas of this country. In fact, there is a hospital in the north where every single doctor, including the head of department, left the hospital the same month for a country abroad. Every single doctor in that department. Now what this is now creating are gaps, and these gaps are being filled by quacks. you know. So you enter in, so just like your car develop a fault, somewhere along the highway and you're looking for somebody to help, you know, anybody holding a spanner or a screwdriver at that time would be a mechanic. So that is happening a lot. And so quackery is festering, you know, at a very alarming rate in this country because there are gaps created by the exodus of qualified practitioners. So it's not the doctors that I would advise because patriotism in itself is a difficult thing to practice in this country. You know, it's very difficult because you have people that you see every day. Imagine one day I was called for an emergency while driving frantically towards the hospital. I wasn't on duty that day, but they were overwhelmed. I left the food I was eating and I got on the road, only for me to be harassed, so to say, by policemen escorting a politician. You know, they would not allow me that because they had to do their thing on the way. You know, despite the fact that I had access to one and I said, look, I'm a doctor, I need to pass for an emergency. They didn't answer me. You know, these are the kind of things that annoy you in a country like this. So patriotism is difficult to practice, especially when you see those who are asking you to be that they are not.
Thank you so much, Sai. It's great talking to you on this discussion. Thank you once again. Thank you. And to you out there, thank you for being part of the show. We are indeed glad that you are able to join us. And I hope that you've been able to learn one or two things. Yes, patriotism is very difficult to practice, but let's just keep doing our best to make it work. And for medical practitioners, I wish you well.